This is Lindsay. She is the night nurse just coming off of her 12-hour shift. She will be giving a report to Taylor, the oncoming day nurse. It was a hectic night, and she now has 4 patients to report on.
Hey Lindsay, how are you doing today?
Good, ready to start my shift.
And I'm ready to be done.
I bet.
So let's get started with this.
Alright.
So today, your first patient is Miss Scarlett. She's a 34-year-old female, and she was admitted yesterday post-op for a right-sided salpinectomy.
Okay.
That was after her ectopic pregnancy, so right now she's very stable, but she's been emotional
Understandable.
about the fact that she might not have kids. That's kind of understandable. Right now she has a dressing on her right side that will need to be changed sometime today, just when we get to it.
Okay.
No big deal. I gave her Norco at 4 a.m. for pain, which she rated a 7 out of 10. After that, it went down to a 4, so...
That's really good.
Yeah. So she'll be needing meds again around 8 o'clock. Really, all I suggest for her is that she talks to a chaplain or counseling services for well-being right now, her emotional well-being.
Okay, and is this her first ectopic pregnancy?
She had an ectopic pregnancy 3 years ago on the same side, but it was successfully managed with methotrexate.
Okay.
Dr. McSteamy decided to remove her fallopian tube this time around. That way, there's a reduced risk.
Okay. What is her support system like here?
She has a husband, Matt. She has her mom. They're all at the bedside for support. They really appear to be upset, but they're handling it a lot better than she is. So
Okay.
That's good.
Good.
Do you have
They're
anything?
really helping her out.
Yeah, they really are. Do you have anything else?
Nope, I think that's it. Nope.
Okay. Well, your second patient today is Mr. Plum.
Okay.
He is a 60-year-old male, and he was admitted 3 days ago for an exacerbation of congestive heart failure.
Okay.
He has a history of type 2 diabetes. He had an MI 2 years ago. He's widowed, and he also works as a professor at the local college.
Maybe I can talk to him about that.
Yeah. He presented with significant dyspnea and chest pain, and also some bilateral edema.
Okay.
Let's see, what else about him? He is refusing to use his incentive spirometer.
Not
Yeah.
good. Okay.
So you might want to tell
Work
him,
on that.
educate him about that, get him to use it. Right now he's on Lasix and digoxin for his heart failure, and he's currently on sliding-scale insulin.
Alright.
I recommend checking his glucose level right away and giving him insulin before breakfast.
Okay.
And his last glucose level was 141.
Okay. Has he been out of bed? Has Professor Plum been out of bed much? Like, what is his activity level like?
He hasn't really been out of bed at all. He just has terrible time breathing on exertion. So
Okay.
he can't get very far. He needs to get up in the morning too for his physical therapy. So if you can get that going.
Alright. Try to help him with that.
Any questions about that?
Nope, I think I got it.
Okay. Alright, well, your third patient is Mr. Mustard. And he was a 29-year-old male. He was a colonel in the Army and just returned from Afghanistan a few weeks ago. He's currently suffering from PTSD.
Okay.
And he was admitted yesterday for overdosing on various narcotics. We think it was a suicide attempt. Yeah. He's awake, alert, oriented, but he's emotionally unresponsive to all the nurses on staff. So, and there's an order to check on him every 15 minutes. So that's kind of important.
Why is he on our floor instead of on site?
Well, since he came in on an overdose, we have to medically stabilize him before he can be transferred to psych.
Okay.
So you just kind of have to check on the transfer status, really.
Alright, I can get that then.
Okay. Anything else on him?
No, okay. Sounds good. And the last patient?
Our last patient is Miss Peacock. She's a 20-year-old female, and she had a laparoscopic cholecystectomy yesterday.
Okay.
It was supposed to be an outpatient procedure, but she was admitted for excessive nausea and vomiting. Her medical history is gallstones, and that's basically the reason why she's here.
Yeah,
for
she's still
surgery.
pretty young.
Yeah. Oh yeah. She's doing well though this morning. The nausea subsided, and she's waiting to be discharged by Dr. McDreamy. Dr. McDreamy. She received Zofran at 2 this morning and may be requesting pain meds when she wakes up.
Alright, I know you had a busy night, but has the paperwork for discharge been done yet?
Nope. Sorry, it was just a little crazy last night.
Alright, thanks. I think I got it. Go get some sleep, Lindsay.
Thanks.
After receiving a report, Taylor is taking a few minutes to prioritize her patient care for the start of the shift. She is looking at the MAR for immediate meds to be given this morning and in the charts for new orders on her patients. She is now about to talk to Melina, the nurse aide, and delegate several tasks.
Hi, Melina. How are you today?
Hi, I'm good. How are you?
Good. So Lindsay just got off her shift and told me about the patients for today. We're going to have 4 patients in room 2, 3, 7, and 9, okay?
Okay.
Alright, so the first patient is Miss Scarlett, and I'm going to need you to check her. She's in room 2. I need you to take her morning vitals and kind of clean her up some if she needs to be, okay?
Okay.
Alright, and then Professor Plum, he's in room 3, and I need you to take his morning vitals and also weigh him, and then get that information to me right away.
Okay, yeah, I can do that. Do you need vitals on the other patients as well?
Yeah, I'm going to need them as well.
Okay, I figured.
Alright, and then Colonel Mustard, he's in room 7, and he overdosed on different drugs, and he's also here with PTSD. So we're thinking it was like a suicide attempt, so I'm going to have you check on him on the hour, and then 30 minutes later, and then I'm going to check on him like a quarter after and a quarter till, so we're both checking on him every 15 minutes.
Okay, yeah, that's fine.
Alright. And then our last patient, Miss Peacock, she's in room 9, and she's supposed to be discharged later today after Dr. McDreamy makes his rounds. So there's not really too much going on with that. But I need to remind you that Professor Plum has not been using his incentive spirometer. So if you could just help him out with that, remind him why he needs to use it, and maybe go over it with him again, that would be great.
Okay, let me see if I got this straight. You want vitals on all the patients. For Professor Plum, I need to weigh him, get it back to you, encourage him to use the incentive spirometer, and then also check on Colonel Mustard every 30 minutes, correct?
Yes, on the hour and then 30 minutes later.
Okay, perfect.
All right,
I'll see you
sounds good.
later.
Yep, well, have a good day.
Now that Taylor has delegated tasks to the nurse aide, she is ready to meet her patients and start care for the day. She has chosen to start with Professor Plum and check his glucose so he can have his insulin before breakfast. Next, she will check on Colonel Mustard, introduce herself, and perform his morning assessment while attempting to establish a therapeutic relationship. Mrs. Scarlett will be checked on next. Her morning assessment performed, incision checked, and pain level evaluated. Miss Peacock will be checked last and informed that she will be discharged. Next, Taylor will prepare to administer any 8 o'clock meds and finish any assessments. For the remainder of the morning, she will work on Miss Peacock's discharge and continue to check on Colonel Mustard. She will adjust prioritization of care and delegation of tasks based on the events of the day.
Oh, Colonel Mustard.